Hi everyone, welcome back to the Medical Writing Insider series. Today we have Dr. Sushmita Ganguli with us. First, I'll go ahead and introduce Dr. Sushmita for all of you. She is a medical and scientific writer, and she has spent 19 years in clinical practice as a homeopathic physician. Then she has successfully moved into medical writing and has built an expertise across medical communications, medical marketing, publications, and medical journalism. Right now, she leads medical and scientific writing projects and continues to work as a physician, homeopathic physician. So, a warm welcome, Dr. Sushmita. And this has been long planned, and somewhere in between we could not connect, but I am so happy to have you today.
Thank you so much, Dr. Shatabdi. It's lovely meeting you here as well.
Yeah.
And hello to everyone out there. So I look forward to our conversation today.
Absolutely, absolutely. So, Dr. Sushmita, I have some really interesting questions for you, given your background and expertise across different fields and
Mm-hmm,
niche in
mm-hmm.
medical writing, right? So, the first question that I have for you is you have spent so many years as a homeopathic physician, right? That has been your bread and butter for so many years. So, what made you transition after this long journey as a homeopathic physician? What was that trigger?
Okay. So I would say there is not a one particular trigger into this. It was more like a gradual realization.
Mm,
So, like currently, I'm basically physician with a background in homeopathy medicine.
mm,
And currently, I am associated with Clinics, which is a clinical research organization, and we are having expertise into conducting clinical trials across all the four
mm.
phases.
Mhm.
And it's like a full service CRO. And additionally, we are also a member of ICROS, that's Association of International CROs, and this helps us to conduct clinical trials globally.
Mm.
So these are two different aspects. Like I was completely into a clinical role, and this is completely into a non-clinical role now. So the thing happened just as the situation evolved, I would say, rather. So I still have got my homeopathy practice. I've got a digital clinic, and but that's a side hustle as of now. But I have transitioned myself completely into medical writing.
Yes.
So when I was completely, I would say 100% into a clinician role. So I still love, and I always loved interacting with patients and understanding their problems, all these things. But gradually, I realized, whatever knowledge I am disseminating, it can go to a wider audience.
Mm.
And that's the time wherein, and I always had this, interest in reading scientific literature, journals, and all this thing. So, and I didn't realize at that point of time that I have got, good skills in writing as well. That's when I actually, started reading these journals and scientific literatures and all. So that clicked me that, I can move one step ahead, and I can, venture into an industry wherein it will give me more opportunity to provide knowledge, and in a accessible way, whether it's for the
Yes.
patients, whether it's for the physicians or the researchers. So that is when I start, it's a proper time for me to transition from a clinical role to a non-clinical role.
Yes, perfect. Also, Dr. Sushmita, I am now intrigued to ask you. So, after spending so much of your energy and time in one
Mm-hmm.
profession, like we all do, right?
Yeah.
So we all get
Yeah.
trained, do our graduation, post-graduation, just because we want to
Mm-hmm.
become doctors, right? Healthcare
Mm-hmm.
professionals.
Right.
How easy or how difficult or what is the main challenge that you faced when you decided that I want to transition or when you slowly started moving into a completely non-clinical role?
See how it happened. As I told you, it was a situation involving, and the realization happened gradually. So, I would say once you realize where your passion lies, okay, automatically the interest which is there you are inculcating, you can automatically transition yourself. It will give you that push. The same thing
Yes.
happened with me. So I understood, okay, I am like, having that skills, and like, I'm confident with myself that I can transition into this non-clinical role as
Yes.
well.
Mm,
Because
mm,
the platform was like when I was into a full clinical role, when I was
mm,
seeing patients upfront. So that time I was also working back end. Okay, so because being a homeopathy physician, we take case history, we analyze that. So all those skills, like the critical analysis thing, understanding the patient psychology, what the patient expects. Okay, the same things are required for a medical writer as well.
mm.
Okay,
True.
so this thing helped me to, transition and start my transition. Actually, I would say I'm still transitioning. It's not that I'm completely evolved, because see, we all are learners. And I
True.
believe in that. Once you stop learning, then it's the end.
There's
Okay, and
nothing in, yeah.
being into a medical field, definitely it's a science. It evolves, and you need to adapt to it. So
Yes.
accordingly, I have positioned my career.
Perfect, absolutely. So, Dr. Sushmita, like you said, and from my experience also, so we have a lot of skill sets which we don't realize we can transfer into our non-clinical roles, right? For, patient
Right.
communication, we are
Mm-hmm.
taking patient histories, we are already doing some of the work that we need to do in medical writing, right? But
Correct. Right.
most people who begin as a new medical writer, we don't realize this skill set that we bring, right? So,
Correct.
you think that this kind of helped you in your medical writing journey so far? So, what was that one thing that actually helped you from your clinical journey? And what was that one thing that you had to, unlearn when you started your non-clinical medical writing journey?
So the thing is, your communication skills are, your asset. Okay, so whether
Yes.
it's a writing skill or whether it's your the way of communication, like right now, as you must be also knowing, when we are into this profession, we interact with clients. Okay, so your skills of networking, your
Mm,
skills of collaborating,
mm,
along with that timelines adhering to that. So when I was like treating patients as well, okay, I just can't go on for the treatment endlessly. I know that I need to see a change within this frame of time. So that
mm,
timeline
mm,
adherence is very much required.
mm.
Okay, same thing is critical for medical writing as well.
True.
Okay, that shows your professionalism as well, right? The
Yes.
clients are always happy, and they have a long-term association as well. Along
Yes.
with these things, see, we are obviously going to, whatever project is given to us, we
Yes.
are scientifically sound. Okay, we know all the matter behind that. Okay, we will present it. But the thing is to, bring out a long-lasting relation with the
Mm-hmm.
client. That shows
Mm-hmm.
your professionalism. So how you interact, how you
Mm.
basically develop this
Meet
skill. This is an
deadlines.
ongoing thing.
Yeah,
Yeah,
yeah, yeah.
because see, we all started afresh, right? So it's like today, the position to which you are or into which I am, okay, it didn't happen all of a sudden. We
No.
also learned many things as we
Yes,
progressed in our career.
yes,
So these skill sets, everyone would have some or the other skill sets, okay, but
yes.
to polish that is entirely
Mm-hmm.
in your hands. Like
True.
I would say the second thing is about mentoring. Okay, like when I decided to transition into the medical writing. Medical writing is a vast area, so we have got regulatory writing, which is adhering to the guidelines, and you need to be very concise and to the point. Then
Mm.
you have got medical comms. Okay, so in this, your creativity is very important.
Important.
Okay,
Mm.
yeah, so therein you can excel. Okay, there is medical journalism. If you love storytelling, you can work in that field. So you need to understand what are your strong skills which you
Mm.
have, and this
Mm.
you will only realize once you venture into the field and you're into the the practicality. Okay, like during our medical I would say the medicine days. Okay, so we had our theory, but we do have our practicals as well, and that is the
Yes,
area wherein it polishes us, and we get to see patients upfront, and we understand what is the scenario. So
yes.
scientific knowledge is obviously the base. Okay, that is going to the core thing. but
Mm.
to use your skill sets to bring about this sharing thing, sharing your knowledge to the broader audience, that will require your skill sets, and you need to polish it as you get your projects. You will also learn. Maybe
Okay.
you have done
Perfect.
something wrong in the previous project.
Mm.
You will understand, okay, this is where I missed out. I can do well in the other one. Right?
Yeah,
So it's a
yeah, yeah.
transitioning thing, and it's a stepping process. It will not happen
Yes.
suddenly. Like people feel, okay, I have done the medical writing course. Now I know everything, and let's start. This is not going to happen. You will
Yeah.
learn as you start actually delivering the project.
Yes, yes, absolutely. So, Dr. Shushmita, do you feel that, um, say, for example, somebody is taking a medical writing course, right, or a program,
Mm-hmm.
right? So, what is the
Right.
right point of time to start applying to positions? Should they wait for the entire course to complete and feel completely ready and then start, or should they start applying even if their skill match is 60, 70, 80%? How do you think about it?
Yeah, I would rather say, getting a course, okay, enrolling in a course and all is going to give you the basics. Okay, what is the subject about? It will, even tell you things which you're not aware about. Okay,
Yes.
so you get a proper idea about any, it's just not related to medical writing, it can be
Mhm.
with any subject.
Yes.
So, but if as we are speaking about the skill sets, right? You know
Mm-hmm.
what are your strong points. You have understood the core thing, and if you feel that
Mm.
yes, I am able to confidently move the next step, you should
Yes.
be applying to positions, because I
Okay.
believe there are many organizations who take as an internee trainee as well.
Yeah.
Okay,
Yeah.
it can be a paid internship, it can be unpaid also. Like in
Yes.
my when I was actually doing medical writing course.
Mm-hmm.
Okay.
Mm-hmm.
So I interned as well. That was, of course, an
Okay.
unpaid one, but still it
Yes.
gave me, the
Idea of the industry.
leverage, yes,
Mm.
wherein I
Mm.
could interact with the client. I could understand how it is. And because, with me, the advantage was I was already into a corporate field wherein I was,
Mm.
handling business. I was looking after patient care and management. Okay, along with that, I was interacting with a number of
Mm.
people. Okay,
Mm.
so this thing obviously helped me to, when I was
Mm.
taking a project and I was interacting with the client, this was the skill set I knew, okay, I can do it confidently. I didn't have to, struggle in that.
Yeah.
Right, the same thing. So along with the writing skills, as I mentioned earlier as well, these things
Mm.
are also equally important. Because see,
Yes.
whether if you are starting as a freelancer, whether if you are entering into the industry, these skill sets will be always required.
Yes. 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 Absolutely. So, I have also worked as a freelancer and for
Mm-hmm.
like full time, roles. I
Hmm.
think you have also done the same. You have also taken up freelance
Right.
projects, and you are right
Mm-hmm.
now full time working with a,
Hmm.
company, right? Organization. So,
Right.
how do you suggest new medical writers go about it? What is the main difference between these two work cultures? And how do you suggest new medical writers explore it? Freelancing versus full-time roles.
Okay. See, everything has got its pros and cons, right? I mean, if you have the required skill sets, you can make
Mm,
your career in freelancing as well. You can
mm,
venture easily into the industry role as well. Okay, but the thing is ki just the bookish knowledge, the theoretical knowledge is not going to help you. You
mm,
should have that practical experience as well.
mm,
Okay,
mm,
so this will happen only with two things. One is once you start networking with people, okay, you start understanding what is the exact scenario,
yeah.
and then you understand where you fit in actually.
Okay.
Okay, this is one
Mm,
thing. Second
mm,
thing is you should be enrolling into internships, because that gives you a door. It opens your door to a area which you have not explored. Okay, so
true.
you will understand, what are the advantages, what are the disadvantages.
Yes.
For me, what has happened, because I was already into a corporate role where I
Yeah.
was already working with the management, and I was working with the patients as well. For me to transition into a freelancing career initially helped.
Yeah.
But for a person who is a just that is grads or
Hmm.
post
Hmm.
grads, and then
Hmm.
is thinking ki, okay, I will venture into freelancing, maybe creating a hurdle, maybe it will
Yeah.
create a hurdle, right?
Yes.
Because
Yes. Yes.
the exposure hasn't been there. So as I
Yes.
spoke, the skill sets, polishing your skill sets is equally important.
Hmm.
Opportunities will be always there.
Yeah.
Okay, but you need to fit where you need to understand where you're fitting at the right time.
True. True. So I think starting off with a full-time or in-office role, working with a team, understanding how the industry works, and then deciding if freelancing can suit you or not. I think that would be a good way of thinking about it. Because
Exactly.
freelancing is not only about, delivering the project. It is a lot of things beyond that also,
Exactly.
right? End to end. But if you are working with a team, we have somebody in the hierarchy above us who is, kind of delegating tasks to us. So at some point of time, we don't have all those extra, thoughts in our mind that we have
Support.
as a
Yeah.
freelance medical writer. So
Yeah,
I think
exactly.
starting
Because
off,
uh,
yeah,
yeah, because
Sushmita.
see, what happens is in freelancing, you are alone. Okay, you have to take all
Yeah,
decisions and all
yeah, yeah,
everything.
yeah,
So if you
yeah.
have already, worked on that path, you've already had an
Mm, mm.
experience in that path,
Yes.
so you can do freelancing very well. Okay, but
Yeah,
if you
yeah.
are just a fresher and you are just passing out
Mm,
from the university, and if you
true.
feel that okay, because we have got remote roles and it helps you to settle in, so I can do freelancing very well. So it can backfire as well.
It can
Okay.
backfire.
So
Yes.
yes. So it's better that initially you get into the industry, understand the scenario and all, and then you can plan it out. Maybe you even start liking the industry setup also, and you
Yes, yes,
continue in
yes,
that field as well.
yes.
So
Absolutely.
it all depends upon, the point is it all depends upon what are your plans and how are you aligning it
Mm.
with your plans.
Life goal also,
Rest all
right?
will,
Yeah, yeah.
yeah. So it will, it will flow in accordingly.
Accordingly,
So you
true.
should not
Because,
hurry for
yeah,
one. Yeah, patience is very important. Like you should not be in a
yes,
hurry. Okay,
yes,
you have to
yes.
give time. That is also one skill set. So
Yeah, and
these
that is
things
so
are
much
equally
lacking
important.
right now. Patience is so much lacking among people. I see
Exactly, exactly.
after trying for 1 month, 3 months, people give up. Right? I remember I
Mm-hmm.
was struggling for 6, 7 months, 8 months at a stretch before I got my first freelancing project. So that is
Yeah.
patience is, I think, one thing that we need to, have. And also, Dr. Sushmita, tell me, so what is that one thing, like not thing, I would say quality, that immediately, separates a good medical writer from an average medical writer?
Okay. See, as I told you, the basic core is the scientific knowledge. So whether you
Yes.
are a physician or whether you are coming from, the other life sciences
Yeah. Yeah.
background, it all depends upon what theoretical knowledge you are carrying, and it's an
Bringing.
evolving thing because it's science. You have to be adept at learning whatever new things are coming up.
Hmm. Hmm.
Okay.
Hmm.
So I mean, one quality, if you're asking me, like what I see in
Yes.
individuals is like what kind of attitude you are carrying once you are into the the industry, or
Yes.
your openness to learn, your
Hmm.
openness to feedback what others are saying.
Hmm.
Like we were speaking
True.
about the mentoring thing. Okay,
Yeah.
like we also met through a common mentoring session
Yeah.
only.
Yeah.
So yeah, so mentoring is like wherein you get a chance to interact with people. It's a chance to
Yes.
network. It's a chance
Yes.
wherein you get to learn many things. Okay,
Yeah.
but if your mentor or your colleagues are saying something and you're not open to
Hmm. Taking
accept
it.
that thing,
Hmm.
yeah, so that is again going to backfire. So you
Yeah.
should be open to to be receptive, like how we say a good
Yes.
listener. Being
Yeah.
into the
True.
medical background, we have that thing, right? So we are a
Yes.
good
True.
listener because we listen
Yeah.
to patients' queries and all. In the same
True.
way, we this thing is equally important for medical writers also. So
Yeah.
your other skill sets play a vital role as your writing skills go. Okay, so
Yes.
you may be very confident in converting the scientific data into for a audience who is a patient, okay,
Yes.
or a physician. But if you
Yeah.
don't have the other skill sets, wherein if you're a manager or if your reporting manager is, or if your client even is
Mm,
giving you a feedback and
mm,
you are not able to take it,
mm,
so that
mm.
is going to create a hindrance in your career only. So
Yeah.
these things is what we look for. Okay, so whether
Yes.
it's a fresher who is joining, or whether who is there in the industry for a very long time, these
Yeah.
all skill sets are always going to be there.
Yes, true. Also, I think, Dr. Sushmita, like because we are healthcare professionals ourselves, we get into a habit of, like taking things into our hand when we are into clinical practice. So when a patient walks in, I am the person who is, you are the person who is looking at the person, diagnosing, giving the treatment protocol, planning everything, talking with the, patient's house members, home members, family members. So we are not accustomed to follow orders, right? But I think that is important. That is also an important thing when we move into a non-clinical role, to understand that there is a hierarchy. There might be somebody above us, and we need to understand what they are saying, why they are saying it, take those feedbacks and improve our work. So that learning agility, I think, is one of the best things to have throughout our careers as a medical writer, like you just pointed out, right?
Exactly. True, true.
Yes, perfect. So, Dr. Shashmita, tell me, you have worked across different niches in medical writing. You have worked across medical communications, publications, medical marketing. Okay. So, how does one person who is very new to this field, okay, how does that person understand which particular niche to follow? How do they understand that? Because medical writing is such a, umbrella term, spectrum. So,
Correct.
how do we go about it?
See, I would say, one thing is your passion, wherein it lies. Second
Okay.
thing, the skill sets come in place. Now, for example, if a person is more technical, okay,
Yeah.
so he or she can explore the regulatory writing,
Yeah.
branch, because therein you have to be concise. You have to adhere to the guidelines only,
Yes.
and it is a structured way.
Yes.
Second, in Medcoms, what happens is, it is all about your creativity. If you're a more
Creativity. Yeah.
creative person,
Mm.
yeah, and
Mm.
you're able to convert the scientific thing into lay terms or the
Yeah.
physician language as
Yeah.
well. So you should
Yeah.
opt for that. Okay. If
Okay.
you love storytelling, there's medical journalism. Okay.
Yes.
So then there's medical marketing, wherein you have got those,
Strategy planning.
exactly. So, the field is vast. It all depends
Yes.
upon, one is what your interest lies in, what you're
Yes.
passionate
Yes.
about, and
Yes.
you align your goals accordingly. So, definitely you are
According.
going to succeed in that. Yes,
Yeah. So do you think that they can start exploring the different formats first, get their hands dirty on small projects to understand what actually, they are passionate about, so that they can finally
exactly.
narrow down? Is that a good way?
Correct. It's a good way
Okay.
because, see, once you are out of the medical school, or say like you are out from your college, actually, university, and you feel that, okay, because I have come across many medical writers
Mhm.
who were like into, the life sciences background, and they were into publications and all, right? Because you need to do those things.
Yeah.
And then they realized, ki, okay, okay, this is aligning well with my skill sets and I can move into this. So they
Okay.
venture into medical writing and
Mm.
they progress.
Mm.
So many things happen during your college days as well, when you
Yes.
are actually into the
Mm.
university, okay, doing your projects at that time. Okay, will
Mm.
also let you know, ki, okay, where my interest actually lies in.
Lies. Yeah, true, true.
So, so once you have done the course is, the medical writing course is your, a basic start, okay, wherein you are
Mm.
getting a basic knowledge about the profession, okay,
Yeah,
and what are the deliverables and all, you will understand accordingly.
yeah,
But
yeah,
once you start taking the projects, and you will actually realize where your interest lies truly in,
yeah,
because it
true.
would be a practical aspect, okay, and you
Yes,
will be
yes,
doing it on your own.
yes.
Okay, so this is going to help you. So initially, I would say don't be in a rush. Okay, take your
Okay.
time, be patient.
Mm, mm,
Okay, see where your interest lies in.
mm,
Okay,
mm,
do a couple of projects. Even if you're getting an opportunity
mm,
for internships,
mm.
okay, forget it whether it's a paid or an unpaid one because you're just starting your career. But at least go for it, and you will
Yeah.
understand. Okay, actually, where I can move ahead in my career.
Yeah, true, true. That's the way to go ahead. I think instead of, narrowing down instantly on one particular field in medical writing and
Exactly.
sticking to it, exploring different formats and then understanding is the good way to go stuff. Yeah. So,
Absolutely. Yeah.
right. Yeah. So, Dr. Shushmita, tell me there are so many healthcare professionals, especially who are women, who have taken career breaks in their 20s,
Mm-hmm.
30s, 40s, okay, due to different
Mm.
reasons. So, what is that one suggestion that you have for them if they want to come back after a break into the workforce? Because you have done it
Yeah, I
yourself.
was Yeah. See how it is, taking a career break is not like, you're stopping your career entirely. Okay. Actually, when you are in a break, you are going to, polish your skills a lot. You will learn more
Yes.
about resilience. You learn more about empathy. You learn more about multitasking. Okay.
Yes,
So
true.
this is going to again further help you.
Help you.
Moreover, you can also utilize this time. See, science is evolving. You can always keep yourself updated to it.
Yeah.
Okay.
Yeah.
And once you feel that, okay, I want to restart my career, people are always there in the industry to support you.
Mm, true.
It's a misconception that people don't support you or it would be a negative thing in your career.
Yeah. Yeah.
It doesn't happen in
Especially
that way.
women. Yeah. Especially women. Actually, I have seen come forward and help women. I have seen that so
Yes,
much.
yes. Yeah, I have experienced that. So don't get tensed about it or anxious about it. Okay, this is a
Yeah.
good time for you to actually reinvent yourself. Okay, so it's not going to take you a step back. It's always going to take you a step ahead. So you
Yes,
need
true.
not worry about any breaks as such.
Yes, true. Perfect. So I think with that, we come to a close of today's session. I would have loved to continue ask more questions to Dr. Sushmita,
Same
but
here.
again, we have our limits, right? Yeah. So
Yeah,
maybe we
that's
will
true.
connect back again sometime, so that we can
Definitely
chat
yes.
on, yeah, on some other
Yeah,
topic. For today, let's close. And thank you so much, Dr. Sushmita, for doing this with me. If any one of you want to connect with her, I will share her LinkedIn in the description box below. And for projects and collaborations, also, please make sure that you can get in touch with her. And Dr. Sushmita, any closing words you have for us?
yes, so I would just say that it was lovely interacting with you today on this
Thank you so
platform.
much.
And yeah, it was a lovely time. I enjoyed a lot. It was like, the conversation actually kept moving. It was an unplanned thing and it
Naturally.
just happened
Yeah, yeah,
impromptu kind of thing.
yeah.
So I look forward to, interacting with you on some other subject again.
Absolutely. Absolutely.
Yeah,
Thank you so much, Doctor. And take care, guys, till we meet again. Stay healthy, stay happy. Bye.
yeah. Thank you. Bye.